Today's Victorian Tasmanian Community Transport Association. What a time it is right now. So ever evolving, ever changing. I'd like to start off by doing an acknowledgement to country. So I acknowledge the traditional owners of the lands we all meet on today. For me, I'm on the Wurundjeri land of the Kulin Nation. I'd like to pay my respects to elders past, present and emerging. So we have a fantastic panel of guest speakers on today. We've got Professor Graham Currie. He is the Chair of Public Transport, Director of Public Transport Research Group, Institute of Transport Studies at Monash Uni. We've also got Savannah Jewell, who is our Senior Policy Officer at National Disability Services, and Elias Lebbos, who's the Chief Executive Officer of Travellers Aid in Australia. So an amazing panel today. So welcome to the three of you. So we'll start off with Graham, who will be talking about his work, and then we'll go on to Savannah and Elias. And we've got some time afterwards to talk about questions and discussions. I'm sure there are many out there today, especially with all the recent border closures and impacts that have had upon us on all of our community transport. So let's start with Graham, and we can start his presentation. Thanks, Graham.
Okay, I'm just going to share my screen. This presentation's about some work we're doing, trying to understand the long-term impacts of COVID-19 on travel. Lots of concerns about this. And indeed, you know, a worldwide media campaign really emphasizing doom and gloom, if you ask me. And can be seen in a very negative way, but we need to get some facts here because this is our lives. It's the lives of all the people we care for. And we need to understand how our businesses are going to change into the future. So we are doing this research project and it's about the long term. And we've been looking at research literature firstly, and then we've been doing some research in the community. Disruptions to travel are quite common. We've already had epidemics of various kinds that have had impacts on travel. We've also had security threats such as 9/11, terrorist attacks in London. We've actually redesigned cities for major events such as Olympic Games, which really changes host cities immensely. And these things can have long-term impacts. And when we have unplanned events, such as, you know, failure of railways, disasters, cyclones, and then we've also had economic crisis, you know, the world economic recessions. Now, each of these events, when we look at the evidence, have created things like fear, which of course is an issue now, fear of going on public transport. We've had planned disruptions that have really changed alternative modes of travel quite significantly in host cities of the games. We've had unplanned disruptions that have occurred for a long period, actually, and we know what the outcomes are. And then economic crisis. But our interest in the research is really what's happening in the long term as a result of this. And there's a simple answer, and that is that although we have quite big effects on travel in the short term and during events, there's very little evidence that long-term effects occur when these events are over. It's very hard to measure, and they're of the order of, you know, less than 5% change in travel overall. Will the same be the case for this crisis? Let's see. But I'll give you one piece of evidence, which is very interesting. This is particularly the graphic on the right, is the evidence from Hong Kong and Taipei from the SARS virus outbreak, which is quite recent. And also SARS was very badly affected those cities. And what this shows is the ridership on the transit systems in Hong Kong and Taipei. And they were very badly affected for only a few months. And once the outbreak had gone, ridership returned to normal levels. Now, SARS is interesting because there is actually no cure to SARS. It sort of just died out. And this suggests that although there are quite big effects we can measure, long-term effects don't seem to change a lot. They tend to come back to normal. Will that be the case for COVID-19? Let's see. We have a research approach we've developed at Monash. Our interest is the very long term, in particular, when the virus is gone. Now we have the pre-COVID travel, we've got shutdown. We've actually had 2 shutdowns. We've had shutdown, the first one, post-shutdown, this is Melbourne, and then we'll have a second shutdown. Then we've got post-pandemic when the virus is gone. We've created a way of exploring of impacts on travel. We know that pre-COVID, where we lived, where the land use was, what modes we had, our mobility and lifestyle choices affected travel. But during COVID, we think there are 3 things affecting travel. There's a macro set of things about the economy, tourism, big, huge changes that are going on, which change travel. There's also micro effects, you know, home isolation, travel restrictions, illness. Working from home is obviously very big, more deliveries and teleworking at home. Increased fear is changing how we do things. And then there's a meso effect, which is about your local community and whether shops are open or whether transport systems are running. And the research we're doing is monitoring all this over time, largely through field surveys for micro effects, which are actually underway now. And then we're looking at macro effects in the long term. I can show you some of these results. We're about halfway through the first phase of our work, so I can show you some results. These are interviews we've done across Melbourne with residents using a sampling frame to get lots of diversity of people. And we've asked a whole series of questions about travel before pandemic, during shutdown, post-shutdown, what was influencing them, and explored a lot of these issues we're interested in, micro effects, working from home and so forth. So let me just show you some results. These are the question was, how do you expect what you do and when you get around will change when the virus is gone? And these are interviews with individuals to understand, you know, how they're thinking and so forth. And I'm going to show you what they said. Each person will be a separate yellow box, and this is what they told us. Okay, so post-pandemic, when the pandemic's over, when there's no more contagion, every person we talked to said they will go back to traveling the way they did beforehand. We also asked, will you use public transport? We're very concerned about public transport now, but when the virus is over, will all these changes have affected their travel? And this is what they said. So, you know, some people said they had no choice, but we didn't find anybody who was a public transport user who wouldn't go back and use it again. Was fear an issue? We asked the question, post-pandemic, will you have concerns about infection in public transport? And there were a lot of concerns. There's no doubt about, we're concerned about fear. But interestingly, everybody still said they'd go back and use it. So I also want to close by just talking a little bit about macro effects that are occurring in our city that could also change travel. These are sort of the effects here about changes in the economy and so forth. One of the biggest issues is growth. We've been facing massive growth in Melbourne. Will that occur in the future? And as you can see from this graphic for Melbourne, you know, 68% of all that growth was driven by migration. Now, thinking medium term, you know, a few years' time from now, when travel returns and we're allowed to do international travel, will Melbourne be a good destination for migration, or will it be worse than it was before? Now, I'll know we're in a second wave in Melbourne, but, you know, Spain had 28,000 deaths. The United States has over 130,000 deaths, and Australia has 104. Well, our pandemic performance has been spectacular. And I think that will actually change how attractive Melbourne is seen, or other cities are seen, Australia is seen. And I would put it to you that in the long term, or medium to long term, we've got a good chance of going back to growth. The second question is employment, because we're facing a great big challenge economically. And this is 3 graphics about that in our history. The first is some trends of routine jobs. This is unskilled labor, which has definitely been in decline for a long time. But if you look carefully at it, you'll see those are economic shocks occurs in the 1990s, 20s, 2008. Each of those shocks tends to give a greater downward trend to routine unskilled sort of labour jobs, which is going to definitely affect that group. But the other two graphics also tell us something else, and that's really the long-term history of employment in Australia, and literally a century. And you'll see the Great Recession, we had massive unemployment, 20%, but we came back. And the truth is that each of these shocks have a bad effect, but they're not permanent. Indeed, the last graphic on the right is the history of the recent recessions, the most recent. And both of the most recent recessions recovered within 10 years. So overall, we have a picture here of three sets of different sources of evidence suggesting a very clear outcome. There will be changes in travel in the long term when the pandemic's over, but they won't be substantial. We're likely to go back to what we did beforehand. Why? Well, the urban form of our cities haven't changed. People still want to work and live and go and do things. Where work is in the same place. Where what transport systems we have are in the same place. And as long as the pandemic is over and there's no more infection, we're likely to go back to normal. If people are interested in these findings, we have a podcasting series, which is all free to use. It's called Researching Transit. And if you go to www.ptrg.info, it's all available there. Thank you very much.
Thank you so much, Graham. That was a really interesting presentation. Kind of reassuring to know that once the pandemic will return to normal. So that was a bit reassuring, especially here in Victoria. We will leave questions towards the end. But please, as Suzanne wrote, if you have any questions, please type them on that chat board. Next, we have Savannah Jewell, our Senior Policy Officer at National Disability Service.
Yeah, hi. I might try and share my screen as well. So just bear with me for a moment. Oops. Okay. Can you see my PowerPoint? Yeah, okay, great. Just see if I can find my, sorry, didn't work properly. I can't see my notes. Hang on a second. Okay, let's try this way. I'm having trouble. Just bear with me, sorry. And can you see my slides now? Yeah, okay, great. And I can see my notes, so that's a lot better for me. So good morning. My name's Savannah Jewell. I'm the Senior Policy Officer at NDS, National Disability Services, and I'm here on behalf of State Manager, Acting State Manager and Policy Manager, Sarah Fordyce. Sarah sends her apologies. So by way of introduction from me, I've been working at NDS for 5 years now, and I've been supporting providers transition to the NDIS and transition to the NDIS quality and safeguards and that sort of thing. So I come with, I guess, an operational focus. I wear a number of hats in my senior role, and I look at SDA and SIL as a senior policy officer, support transition to both of those, you know, NDIA and the NDIS Quality and Safeguards Commission. And I also coordinate the NDS help desk where members can post questions and that sort of thing. So just in terms of understanding my role and my perspective on the presentation that I'm about to deliver. So I thought, just in this brief time that we have together, I might just touch on what some of the Victorian government announcements have been and some of the measures that have been introduced to support providers throughout COVID-19. So it will be more Victorian focused at the start, and then have a look at those measures and also just have a look at the definitions of transport, general transport, activity-based transport and specialised transport as well from the NDIA. So the Victorian Government and the Chief Health Officer have announced that we're still in a state of emergency. Heavier restrictions for Metro Melbourne and Mitchell Shire And there's seen the reinstatement of the Chief Health Officer directions. So they're the stay-at-home directions and a number of others, and most notably for disability sector, it also includes the care facilities directions. So that's in relation to your group homes and those sort of things. I've just put a few links there in regards to some info about personal protective equipment and those sort of fact sheets that I find sometimes difficult to find online. So, you know, I like to have little links included in PowerPoints for easy access to those documents. So the stay-at-home directions apply to Melbourne and to Mitchell, and that means that you can leave the home to shop for essentials, to provide care for compassionate reasons, to exercise and to work or study. The stay-at-home directions apply to everyone, including people with disability, and you know, it will impact providers of community participation supports, and undoubtedly they'll be reverting back to delivering supports in alternative ways. And we've seen that by telehealth sort of practices and online through technology. So we've been asked by community transport providers that are operating in the Melbourne Metro and Mitchell Shire, how that might impact them. And again, the directions apply. So people are encouraged only to be leaving the home in these particular circumstances. Some other restrictions and questions that I've had just today are about leaving home to visit family and friends. So NDS has done a lot of work with SIL providers and most specifically people living in group homes about balancing the rights of individuals with infection control measures. And so these restrictions are slightly stronger than last time. And, you know, it's quite clear, cannot have visitors to your home, can no longer visit friends and family who live in another household, etc. It's listed on the screen. So, you know, it's of particular relevance for group home providers who there have been instances where NDS have seen providers lock down homes completely and not allow people to leave. Or not allow services to come in. And so operating a service must also be in line with the Chief Health Medical Officer's advice, and it can't go beyond those restrictions, I guess, in an attempt to protect the people that live in that home. So something NDS has been working on quite a lot in the last little while with a number of providers. Some measures introduced in response to COVID-19. So the NDIA announced advance payments, so a lot of providers received those. There were changes to the low-cost assistive technology policy, which allowed people to utilise their funds to buy a tablet or those sort of things to engage in telehealth and delivery of service in alternate ways. So we've really seen some innovative styles of delivering service, which has been really excellent. There's been changes to SIL and community participation in regards to, you know, a person not being able to leave their home to go to a centre-based activity, and in those instances, the SIL provider delivering that support on behalf of another provider and being able to claim in that way. We've seen the extension of plans and increased flexibility in core budget to allow participants to utilise their funds more efficiently. In terms of audits from the Commission, and I know not all of you watching today will be registered NDIS providers, but there has been announcements that those people who are undergoing an audit process have a bit of relief and can contact their auditors to reschedule or postpone if that's appropriate. And again, if you're supporting people with disability and claiming, you know, NDIS funds in a transportation sense, then you will be bound by the NDIS Code of Conduct, and that's relevant to all providers, regardless of whether they're registered or not. And I just popped this slide up here because it's a new webpage that the NDIS Commission have created in response to COVID-19, and there's a subscription to a newsletter that comes out quite frequently. So if you're registered or unregistered, I suggest that you sign up to that. It has links to really excellent information, especially in regards to infection control and those sort of things. So relevant pretty much to everybody. Likewise, the NDIA have a lot of information on their website. It is a page that has Q&A, and the Q&A are dated, so it's really excellent to see that you can tell when things have been posted on their website. So I just popped that in there as well. Transport. I might just go into the definitions of general transport, activity-based transport, and specialist transport. Sitting on the help desk and coordinating that and responding to the sector's questions all the time. This is one of the key questions that we get a lot. So firstly, general transport, the terminology has changed. So in the price guide, which has just been released, we use the word general now. So general transport, and I consider this as transport that was always available in the previous iterations of the price guide. So general transport is funded in a participant's plan when it's deemed reasonable and necessary. So all supports that are in a plan must meet this reasonable and necessary criteria. And it's funded through the transport budget in the core component of a plan. So not all people with disability will receive general transport funding. If they do, it will appear in the transport budget. And it's for things like paying for a taxi when seeing friends and family, traveling to and from appointments, traveling to work, those sort of things. And it can be managed in a number of ways. And I've just popped those up there, but I think most notably, the term periodic payment is not widely understood. The periodic payment is when someone receives transport funding into their bank account. And by doing this, it becomes a stated support in someone's plan. So they're not able to use flexibility of their core budget to top up their transport budget if it's required. So a stated support means that you must use it in that way. So that's sort of the transport that we have always had. We've always had it in this way, but it has been not had the word general in front of it. And then the NDIA introduced activity-based transport. So the NDIA received a lot of feedback to say, you know, why should a person with disability who is eligible to receive transport funding in their plan have to use it to engage in other NDIS funded activities? And so the NDIA said, yeah, of course. So what we'll do is we'll include a new option, and that's activity-based transport. So activity-based transport allows a participant, any participant, you don't have to be eligible for the general transport that we just looked at, any participant to use their funds for social, economic, community participation or some capacity building supports, to use the budget included in for those supports as a way of getting to that activity as well. So they're not using their general transport and limiting the budget that they have to go and see their friends and families or to get to work. So really pleased to see that that inclusion has been there, and it's been there for, you know, this year. There's also specialised transport. It's another one. It is relatively new and it's for school education employment. And it would generally be for a person experiencing complexity in their support requirements who need transportation that's suitable to meet those needs. It's claimed at a daily charge rate and it's a quotable item. I just popped in here some learning and development that NDS is offering if you're interested about infection control, infection prevention and control, and the contents are listed up on the slide. If you're an NDS member and you'd like to ask a question, you can post it on our help desk. Otherwise, I'm more than happy to take questions after today as well. A part of NDS's role is to connect with the sector more broadly, and that's members and non-members, so happy to do that. And I'll just flag a couple of major projects that NDS has just embarked in, one of them being a Victorian project on infection control measures, so supporting the sector to really understand what your obligations are and how to implement good infection control policies. And some projects on risks and identifying risks and complaints and those sort of things as well. So I will leave it there. I'll just stop sharing my screen and that's it from me. Thanks.
Thank you so much, Savannah. I think those links will be very much useful, especially as we now in Victoria at least go into this second wave. Now we have Elias Lebbos, who is the Chief Executive Officer of Travellers Aid, and this is a nice time for your presentations.
Thank you,
so
Jadie.
thank you.
Thank you. Yes, just confirming. I'm Elias, CEO of Travellers Aid Australia. I'm not sure how many of you actually are aware of Travellers Aid, so I'll give you a little bit of a history rundown and talk to you about what we've been experiencing during this pandemic period and shutdown. So Travellers Aid has been around for over 100 years. It was established to assist women and children transiting through Melbourne and other cities throughout Australia. During World War I, the organisation became a lot more active as women were moving into the cities of Australia to do the work that the men would normally have done. And anyway, just to move fairly quickly because we don't have that much time. In the early 70s, we started to assist men as homelessness started to become an issue. In the 80s, when the Kennett government deinstitutionalised disability care and so forth, we were finding that police in the CBD were actually wheeling people into our facilities at Swanston Street and saying, can you help this person? They've got a disability and they need some assistance. So obviously some bright spark decided there's an opportunity here for the organisation, and we started to care for people with disability. So today we're based at, predominantly based at transport hubs. So Southern Cross Station, Flinders Street Station, and we have a regional service that runs out of Seymour as well, being an interchange station, etc., etc. And what we focus on is enabling people to utilise the public transport system to connect, engage and participate in their communities. So it's about building confidence in people to move about our city and our state, for that matter, independently as possible, utilising the public transport system. So just to give you an idea of what it is that we do, I've got just a short YouTube clip that we were encouraged to put in an application for some assistance from Yarra Trams to be a community partner for Yarra Trams. So this was our application. It was meant to be filmed on an iPhone, so it's rough and raw, but it does highlight the type of work that we do. And what we realised working at stations is that obviously, I know this sounds, it's not rocket science, but people's disability does not end or does not cure at the curb of a railway station. So once people leave our care at railway stations, that they still need assistance beyond. So that if we look at that concept of the first and last mile of the journey, we've been focusing on the last mile of the journey and looking at how we can assist people, not just to utilise the public transport system, but then how do we get them onto the final destination and what support can we assist and provide them in doing that. So Suzanne, if you don't mind.
Yes, I'll just play it now. Internet issue, so hopefully it's just happening at my end.
That's why I got you to do it, Suzanne, not me.
Yeah. Sorry, just bear with me.
Okay.
For many of us, getting on and off a tram and making our way around Melbourne is a pretty straightforward activity. Travel is the key to connecting us to people and place. It allows us to attend our essential appointments, be social, connect with family and friends. It's critical to how we live our life. But for many in our community, it's not as straightforward as you might think. For older people with mobility challenges, people living with a disability, or for people who are travellers in Melbourne, transiting through the city can be quite daunting. Travellers Aid Australia has been helping people travelling through Melbourne to connect, engage and participate by using the public transport system for 101 years. Travellers Aid currently has over 100 volunteers who assist people who are feeling vulnerable to access all Melbourne has to offer by providing support in public transport. Our volunteer companions who accompany people from all walks of life, exemplify a truly inclusive and diverse city. Ensure that the wonderful city of Melbourne is accessible to all, as they teach people the safest way to travel around Melbourne's public transport network. Travellers Aid is always looking at how we can partner with organisations in Melbourne to increase inclusivity. So Travellers Aid wants you to know that they're here to support you, your family, your friends as you travel through Melbourne. And together with Yarra Trams, we can help everyone participate, connect and engage in our communities all across Melbourne.
Thanks, Suzanne. So our traditional services based at the stations, we actually assist people to connect between different modes of transport. So trains, buses, trams, taxis, etc. We also provide personal care. So it's personal care for people whilst they're in transit. So rather than having to bring along their carer, and if they're in the city for 6 or 8 hours, that the carer is being charged out at those 6 or 8 hours, they can pop into either our Flinders Street or Southern Cross station sign. All our frontline staff are disability workers as well, and they'll provide personal care. So whether it's toileting assistance, meal assistance, communication assistance, or the like, all those services are provided free of charge. So, and there's no booking required as well. And the idea behind that is to encourage people to do what they want to do when they want to do. It. And from that clip, you've seen that we've moved outside the stations, assisting people to get to essential services like medical appointments, where they'll be paired up with a volunteer for the day, and that volunteer will assist them utilising public transport to get to and from their essential appointments or social activities. We also have a very strong connection with the deaf-blind community. That's people who are both deaf and blind, and assisting them to transit through the city of Melbourne as well. We've moved significantly into events as well to ensure that people can continue to participate, engage in those major events that we have in Melbourne. So the MCG was one of the big ones, both football and cricket, ensuring that people who've been doing that for the greater part of their life can continue to do that as they start to struggle to connect to those facilities. So something that we all take for granted, maybe a 750 metre walk from Brunton Avenue, Richmond Station to the G, if you've just had or you have respiratory problems or a whole range of either physical or invisible disabilities, then they're the sorts of people that we want to ensure can continue to engage with society. Now, what are we doing today? Well, we're still open today during pandemic. We're open at all our sites. We're an essential service, but obviously we're not doing too much. So there's been a significant decrease in people's travel, and the cohorts that we assist, so people with disability and the older people in our society, obviously high risk, and they have been encouraged not to travel, and now we've all been encouraged not to travel at all. A lot of our work is supporting people from regional and rural Victoria to access services in Melbourne, and we've found that that has reduced significantly for obvious reasons. We did, though, experience a slight increase over the last few weeks, and we noticed that people with disabilities were wanting their freedom back and were venturing out a little bit more than what we anticipated, and to be honest, a little bit more than what we felt comfortable for them, given that some of these people would be in the high risk area. But they're independent and they can make their own decisions when they want to, and that's what we found that some of our regular clients have been doing. What we believe we can add value, or where we can add value throughout this pandemic, is as the world returns to some level of normality, we strongly believe we are in a great position to be able to rebuild people's confidence and encourage people back onto the public transport system. Now, the information that Graham provided seems to demonstrate that people will travel and they will return to travel. And we just want to make sure that for those people who may be sitting back at home thinking, am I ready to, or, you know, is it safe to, or is there support for me to do that whilst I'm transiting to or through Melbourne, then we certainly want to be there to work with government, the tourism sector and the health sector to rebuild people's confidence so that not only we can rebuild an economy, but people are accessing those services that they need to access. In the short term, we're considering what is it that we can do in regional Victoria, and it's an opportunity for Travellers Aid to expand into regional Victoria, but obviously with purpose. And so we're always looking for people or organisations to collaborate with, because without a doubt, people in regional Victoria, if Melbourne is locked down, and Melbourne is a place that where people are being told not to visit at the moment, then they will need to seek those services locally or from other towns and other regional centres. So what we're looking at now and we're trying to figure out is how can we resolve some of those challenges for people and those pain points by assisting them to actually move about regional Victoria with a little bit more ease and a little bit more confidence. So that's what our objectives are at the moment, and that's where we're at. I'll leave it there, Jadie. There's probably some questions. Otherwise, I'll go on for an hour or two if you want me to.
Thank you so much, Elias. I'm one of the fortunate people that have seen the setup at Southern Cross Station with what you guys do out for community, and it's amazing to see what you guys do deliver for people with disabilities. So when times resume to some normal capacity, do have a look, because it is a great organisation in what you all do. All right, do we have any questions out there for any of our panelists today? Suzanne's just put it to everybody, so we'll just give it a few minutes to see if anyone's going to ask any questions. A question I will propose to a lot of you to have a think about is, what are the impacts that has happened? You know, we've got people from Tasmania on this call, we've got people in Victoria, we've got regional Victoria, Metro Victoria. Some of the organisations are impacted by both lockdowns, with the border closures as well as the Greater Melbourne lockdown. So even if you wanted to mention what's the impact that it's having on your organisation, that'd be great, because I can share that with everybody. I know with Red Cross, we've got 4 cars restricted at the moment in regional Victoria because we're trying to get a permit to cross the border into Albury. But then our metro service is also impacted as we're unable to go into the postcodes that are deemed to be the hot zones. As a wider organisation, if anyone's interested, we are supporting some of the towers. Each agency has a tower that they're looking after, and Red Cross is on the ground doing that. We're providing support of distributing food to all the public housing estates in mandatory lockdown, providing telephone outreach across Victoria by the government's COVID hotline. We're also working in partnership with the Department of Health and Human Services, the emergency management sector, and other community services and migration support organisations. So it has been a little bit hectic at Red Cross at the moment, but I'd love to hear what's happening and the impacts within your own organisations as well, if anyone likes to share.
I'll go first if you like.
Thanks, Savannah.
So NDS is a peak body. We have members and we support the sector in that way. So we're a national organisation, and you know, considering the introduction of the NDIS and then the quality and safeguards framework and a few other challenges and opportunities as well that providers are having to navigate in terms of a lot of things. And then when COVID came along, it was a really big challenge for the sector, and we're working with a cohort of people who have a higher susceptibility and in various different, you know, ways and working in different scenarios and areas and that sort of thing. And so from NDS's perspective, it's been a challenge, I guess, to reach and support all of the providers that are operating out there. And we have a number of different sort of training resources that we've developed, you know, trying to keep up to date with the Chief Health and Medical Officer's advice, ensuring that every day you're checking the NDIS website and those sort of things, and trying to connect with providers through things like this, through Zoom, trying to have meetings that are face-to-face but are online as well, and to hear their concerns and be able to support them in those ways. So it's, yeah, I think for every organisation, one small thing that's changed for us that's been a bit of a positive is the way that we can connect across Australia. And we've had meetings where we've had 1,000 people come, you know, and those sort of things. And they've been reaching in all little depths of regional communities to be really able to engage with providers in that way. So, yeah.
Thanks, Savannah. It's great that you've actually been able to see some of the opportunities in all of this as well. I know with ourselves, we've got a lot of volunteers spread across the country, so we're still maintaining engagement with them and even upskilling them in recovery stages as well. So there are lots of opportunities as well as impacts. So thank you. Does anybody else have anything, any questions for any of our guest panelists today? But anybody, if anyone's on from Tasmania, would love to hear what's happening with the situation there, because I know right now the Tasmanian border to Victorians closes as of 11:59 tonight. So is anyone, is that going to have an impact on anyone's services to or would like to share?
Doesn't look like we've got any questions.
No.
No, that's a good thing, I think. Yeah, I would, I don't know, I don't think we're going to get any more questions if we haven't so far. And I might just talk about the next session on the 23rd of July. We'll have LGBTIQ focus. There'll be Alan, the Victorian Commissioner for Gender and Sexuality, Joe Ball, CEO from Switchboard Victoria, and Simon Ruth is the CEO from Thorn Harbour Health as well. So just want to throw that in there at the end.
All right, thank you. Well, thank you to all of our guest speakers today, Graham, Savannah and Elias. I think all of it has been nicely linked together to hearing what's happening out there in all the spaces for all the work that you're doing. So thank you to everyone for joining today. This has been recorded on YouTube. If you've got any questions that you think of afterwards, I'm sure we can reach out to any of our guest presenters and follow up for you. So thank you, everyone. Keep well, stay safe, and just hang in there, I guess. We're all in this together, as much as it's cliched what's out there, but we're all in this together. So thank you, everyone, and have a good day.
Thanks.
Thank you.
Bye.
Thanks, Savannah. Graham. See you.
Bye.
Bye.
Thanks.